good morning.
We are now coming into the holiday season, the beginning of the year.
There we go. Tried to play a commercial there right off the top. And instead, we wanted to say good morning and welcome to Health Talk.
Yeah, good morning, Paul. Health Talk here. And
how's the leg holding up?
Well, I just I had physical therapy this morning, and I also went to see the surgeon, and both reports were I'm way ahead of where I should be for the length of time since I broke my femur. So I'm still in quite a bit of pain, and I'm still not building any strength in my leg, but they're all about flexibility and getting things accomplished, so I don't have to go back. I was told today if where they put the steel plate in my leg, it's really sensitive, and there's a scar there that's extremely sensitive. And he said we may have to take that plate out if that sensitivity doesn't increase, and then you're going to be going through the same thing that you went through before. We're going to have to open you back up, have a regular surgery. And I said,
no.
I think I can handle a lot of pain. Let's just get on with what we're doing. Tell me what we're going to do. And he gave me some exercises to do at home, and to be very repetitive and get them done. He's pretty pleased. Unfortunately, he's a traveling surgeon, orthopedic surgeon, and he won't be back, and so I'll see another orthopedic surgeon in a month and have them reevaluate. But doing good, survived New Year's, as you probably did, right?
Here. Yes, I'm around.
I went New Year's Eve, we went over to some friends of ours' house and had a New Year's Eve dinner, and then we left about an hour before the big bell chimed, and actually watched the bell drop, or the fireworks, in San Francisco.
Oh, cool.
And they were great. Next day we took off and went to the coast, the Little River Inn, and stayed there, and then came back the next day. And it was a gorgeous weekend over at the coast, beautiful. Just stopped at one of the wineries and sat out in the sun, had a little picnic, and got away and relaxed a little bit. We're still working on putting Christmas away, which it takes us.
I did it Saturday. I put mine. It took me 5 hours.
Took us probably 10 days to put it up. So my poor wife loves Christmas and loves all holidays, and she our house, there's not an empty space usually any place for another angel, another Santa Claus, and when those are down, then it's giraffes and elephants. So
giraffes and elephants.
Yeah, and then we had six or seven Christmas trees that all have to come down. So actually, I'm not much good in helping to do those things right now, and I'm. I told the surgeon, he told me these exercises, and I said, well, I may be going to some place that's a little bit warmer for a week. Would I be able to snorkel? And he says, absolutely. It's the best thing you could do. So I may or may not do that. My 43rd wedding anniversary is coming up the 19th of January. So we may or may not run over to Hawaii for a week and just get away and relax. So anyway, it's and then El Nino hit us, and we've got some rain coming in, and I assume you're still the weatherman. Is it still to continue?
Yeah, today's supposed to be actually the heaviest from what I saw, but off and on, continuing at least for the next few days.
And the creeks,
creeks look like they're getting bigger. Lake Mendocino doesn't, though, and
no, we were shocked when we went by there.
Shocked too when I saw it. Recently,
what I did see. However, we were going on Friday to Mendocino, and there was a 4-car accident there at the Potter Valley turnoff. There must have been 40 cars turning off to go up to Pillsbury to go to the snow.
To the snow, yeah, sure.
So hopefully there's still snow up there for people who want to. And we have the first of the year coming, and a lot of people now are facing their deductibles, which some of them just paid off on their insurance and their Obamacare and Medicare and Partnership Health and whatever other insurance plans you have. A lot of people have prescription deductibles that they have to meet before they're able to get their medications at a small copay. Yesterday was our first experience of having to give flu shots for people who had met their deductible in the past, and the first of the year they have to redo that again. So we are going through that painful process at the time, and soon we'll reach those levels. If you have Obamacare, I think you still have until January 31st to sign up for Obamacare. If you have Medicare D, we had to be signed up by December 7th, and so it could be instituted by the 1st of January. So depending on what insurance plans you have, is the kind of pain and suffering you may have to face in the beginning. Now, I've been working since I got hurt about 2 or 3 hours a day, and I've also I'm on a board of directors where we're negotiating some contracts for the next few years for independent pharmacies. So in between all this, I had gone through the pharmacist letter and some of the other legitimate pharmacy in the computer internet programs to get a program for today. And of course, I spent all that time. And because I had to be at physical therapy at 8 o'clock this morning, left it all at home. So we may be talking about some repetitive things that you've had before, since that information is not with me. But one of the things that I was looking at last night was how our inhalers, our bronchial inhalers, are used incorrectly, and especially our rescue inhalers. And those are the ones like albuterol, that Zopanex, that really help you right away, and how people have been misusing them after they've taken the propellant out of them. And there was a small video that showed us how to do it, and one of the medical management groups actually tells somebody if they've not used their inhaler for over 2 weeks, they need to reactivate it again. And the way you activate it is shake it up really well, and then pump it, and just waste that pump just to activate it. Do that 3 times or 4 times, and you're going to be losing about 4 puffs of the inhalant, but you need to shake it up and then puff, wait a minute, shake it up, and then puff. Now, if you're taking the inhaler as a treatment and it's already been activated, with these new inhalers you have to be a little bit more careful. And so if you give 2 puffs every 4 hours, you shake it up really well, and as you're shaking it up, you're letting the air out of your lungs, and then you press on the inhalant, which releases the medication, and then you inhale it. The old ones shot it back in the back of your mouth. You have to actually draw it out of the inhaler as you've already shaken it, and now you've pressed the button, releasing it, and then you're inhaling it, bringing it in, and once you've got it into your lungs, you count 10 seconds before you release it. So then you count 1001, clear it through 1010, and you release it and saturate that tissue. If, in fact, it's 1 or 2 puffs, if it's 2 puffs, you wait 30 minutes or 30 seconds to a minute and do the same thing again. Shake it up, exhale all the air out of your lungs, pump it into your mouth, and inhale that. And once you've inhaled everything, hold it for 10 seconds and let it go. The problem is we're doing, as we've had several of our patients lately go to the rescue inhalers, and they shake it up, pump, inhale it, shake it up, pump, inhale it, and let it go. And you've got to let some time go in between the two and realize that this, when you pump that inhaler, it doesn't go completely into your system. You have to inhale it back into your system. So, and as you get more and more medications, and including eye drops and those things, you will see that a lot of them have different ways of administering them. If, in fact, you don't get told and it's a new prescription, ask the pharmacist, or when you get home and realize I've got a new prescription and I wasn't told anything about it, call the pharmacy and ask to speak to the pharmacist, and the pharmacist will go over that with you. That's something that legally we're supposed to do. Our computers in our pharmacies in the past week and 10 days have been down probably 50% of the time, and you get backed up, and sometimes you forget by the time you get to this prescription it was a new prescription, and people need to have education on how to use it properly, and that's part of our legal system to ask us to do that. So just remember that when you get home. There's nothing worse than, especially now when you haven't met your deductible and you're paying for a high price for something that seems to just keep going up, and you don't know how to get the most benefit out of it. Call the pharmacy, and they need to tell you exactly what to do. Those of you who are on Medicare D, or have been told that you're at the age where you need to get a shingles shot, Zostavax, and we talk about this every radio show, but it makes so much difference in somebody that's over 50 or 60 years old. They tell you it's only 51% effective as far as you getting the shingles virus, but as far as preventing the herpetic neuralgia that you endure from getting the shingles, it's 76% effective. So that's one of the things we need to really cover with people and let them know how important it is. And, you know, one of the things, because most of these people, or a lot of these people, are on Medicare, they want to know why the shingles vaccine costs so much, and because it's over $200. And Medicare does not provide good coverage for this medicine. So if you're covered by Medicare, you may feel that the pain of the shingles shot more in your wallet than your arm. And we've had people question on why they've had to pay so much for this vital vaccine. So if you take a closer look at how much it costs, it turns out that the federal program that insures most seniors in the United States provides poor coverage on some recommended vaccines. And that leaves some older people paying nearly $200 for protection against shingles. Now, shingles is one of those viral medication that often causes a painful blistering rash, and in some cases leads to lingering nerve pain and rarely even blindness. And if you watch these ads on television with Terry Bradshaw and some older actors that show you this rash, it is just exactly as bad as what's presented. The vaccine isn't perfect, but for people that are 60 and older, it reduces the risk of getting shingles, like we said, about 51%, and that nerve pain by over 70%, according to the CDC. So, and the problem with getting it paid for is that unlike the flu and pneumonia vaccines, which are fully covered as a preventative service under Medicare B, the shingles shot and other recommended vaccines are covered as prescription drugs under Medicare D. So Advantage plans, some of those plans provide better coverage than others, but nearly all of them divide their formularies or the list of covered drugs into tiers according to your cost. And of course, we would like for you to have these drugs on Tier 1 or Tier 2, which are the lower price generics and preferred brand name drugs. But as you'll pay more for expensive non-preferred brands in the Tier 3s or 4, the most expensive drugs are usually grouped into Tier 6. So you guessed it, we found that many of the Part D plans categorize the shingles vaccine as an expensive Tier 3 or 4 drug. Only one company, Merck, makes the shot, and there's currently no generic version of that. And that's what you'll find out with many drugs when you find out a cost is prohibitive. There isn't any competition. So instead of two companies competing to give you the best price, nobody's competing, and they have a disease state or a viral situation where there's only one treatment for it and only one company makes it, and you need to improvise somehow and get that vaccine. And to make matters worse, many of the healthcare providers haven't set up billing systems to file claims through prescription drug plans. So if you're vaccinated at your doctor's office, you might have to pay the full shingles cost up front and then be reimbursed by your insurance. Other forms of insurance do a much better job covering immunizations under provisions of the Affordable Care Act, Obamacare, private plans such as insurance you have through your employer or purchased on a state marketplace are required to cover recommended vaccines as preventive medical care, which they all should be. That means as long as you go to a provider in your network or in your provider plan network, your insurance will pay for the preventative care without a copay, even if you haven't met your deductible. And it's really a shame that they've picked us older Americans who are at the most risk of contracting shingles and the most vulnerable to potentially serious side effects of the disease, often have to pay more than others for the vaccine. So if you're currently covered by a private health plan, but anticipate going on Medicare in the next 5 years or so, one cost-saving strategy is to talk to your doctor about updating all your vaccines while your insurance provides good coverage. The shingles shot is recommended for nearly all adults age 60 and older, and I think now they're suggesting 50 and older. So 3 out of 4 Americans that are eligible for the shingles still haven't gotten it. I know people who have the prescription sitting in our pharmacy right now, and they're, I guess, challenging their risks on getting the shingles vaccine. And one of the things is normally we could come to your house and give you a shingles vaccine, but shingles vaccine is a frozen vaccine. Which means it's in a powder form that's completely frozen, that's kept in the freezer. The only thing that inactivates it or lessens its effectiveness for a short period of time is activating that vaccine so it becomes a force of immunization. Once we have added the water to it and activated it, it's only good for 30 minutes. So you can imagine if we were coming to your house and we'd activated the vaccine and we were in an accident or we forgot to stop by the grocery store or whatever happened, that vaccine would be inactive by the time we got there. So we want to make sure that you get it if you can. We don't need a prescription from your physician. We have a collateral agreement or a collaborative agreement with your physician that allows us to give you the shot. If you've been putting it off getting your shingles shot because you were quoted a high price, check with your Part D plan. You may be able to get it for less. So this confusion about insurance for vaccine can sometimes result in people not getting vaccines at all because in a couple of months, most of you will have met your deductible, and it's a perfect time for you to get the vaccine unless you've just been admitted to the hospital. So don't delay as the consequence of shingles not getting the vaccine. Your best bet may be to get it at the pharmacy in your drug plans network because you still need to get the vaccination. You do not need to get a prescription from your physician. If you want to get vaccinated at your doctor's office, ask them up front about the cost. Does your doctor charge more to administer the shot than your plan does? If so, you'd be on the doc for the hook for the rest of that. So finally, if you don't have health insurance or expecting medical or financial hardships, you may qualify for their patient assistant program. I rarely see that being effective with Merck, but keep that in the back of your head to get that Zostavax vaccine. And the other thing is you will find that many physicians don't want to give that shot because there's very little profit in an item that cost us $200, plus the freight, which would be $220, usually pays around $230. That gives us $10 for administration fee and no profit. So it's something that is going to be a target in the future for people to get that shot covered, and certainly any kind of preventive vaccine. So when you see your physician, you may talk to them about it, or come to your pharmacy if you have a Medicare D plan, and we'll talk about it and see whether or not we think you can afford it or not. So the other thing that we talk about here a lot besides immunizations are painkillers, and how storing those painkillers can be really a giveaway to somebody that wants to come into your home. Americans who have a lot of painkillers sitting around their home, and some of those unused drugs can pose dangers to children and others. In fact, of those who take any kind of prescription medication, more than 80% of the people in recent Consumer Reports poll, they don't lock up their narcotic pain pills like OxyContin, Percocet, Vicodin, and nearly 3/4 said they had children living at home. So that really translate into about 16 million households across the United States where opiate painkillers are in unsecured medicine cabinets. I know, Paul, you don't take a lot of medicine, but do you secure, or your wife secure the medicine in your pain cabinet?
She does. She puts her pain pills in our safe, and that's where she keeps them locked. But she keeps them there because in case we have an emergency down the line and the world's coming to an end, and we'll have some pain medicine in case we're injured in a massive flood or something like that.
Does she ever check the expiration dates and see?
Sure, they're all expired.
Yeah.
It's been a while since she or I have been prescribed anything pain related, so I'm sure they're all expired. And I've tried to explain that to her, but Well,
those are things that if it's a good idea what she has, but people that have emergency supplies oftentimes do not go through
the emergency.
One of the things is in Derby Hat, this fishing club. I take a lot of over-the-counter medication up with me. If I don't go in there, because you'll find generic expiration dates are much lower than they used to be. I mean, used to be they would go for 5 or 10 years.
Oh, wow.
Now it's 1 or 2 years. So you need to check those frequently and make sure. There's even sterile water they put in these emergency kits.
Yeah,
that expires.
Yeah.
Only because they become pathogenic, and then by then they can grow a bacteria.
Well, we have 1 or 2. I think maybe we have 2 now of those bug out kits, you know what I mean, that have all the, you guys sell them at your work.
Sure. Yeah.
For an emergency type of a thing. But the medicines that she has locked up, I'm trying to think, might go back to before. Remember when the world was supposed to end in 2012? Yeah. So some of them might go back even before that. So I'm sure they're pretty well expired.
Yeah, that's a good point. A lot of people did that. A lot of people during the millennium. In fact, I think I was talking to you last week. I actually did a TV show for the local television station that was here on the effects of the medical community at the millennium. Because,
oh wow, yeah, you can
imagine. Thought we were gonna lose all of our data, all of our computer connections. Everything was going to go haywire. And a lot of us did put in emergency kits at that time.
Oh, so you're talking about when we went to 2001 in the year 2000? Yeah. We're talking about when the Mayan calendar was supposed to end in 2012.
Well, maybe she updated the one from 2000.
Well, she didn't have them from 2000. She did at 2012. 2000, I wasn't even with her then, so I don't know.
Yeah,
because we got together in 2006, 7, something like that.
Yeah.
So no, I'm talking about the end of the world in terms of the Mayan calendar.
The real calendar.
Yeah,
that was supposed to go.
That was supposed to, all the earthquakes and flooding and all that didn't happen.
Well, we're going to take a break, and when we come back, we're going to talk to you about where you store those painkillers and why it's so important, and does it only have to be painkillers? Many patients with chronic pain end up taking pain medications from many different physicians. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. Each of your doctors may not be aware of the medications prescribed by other doctors. The result is an increase of side effects that don't necessarily come from better pain control. The drugs are usually prescribed for pain and for a short amount of time, but the length of time can get lost in the shuffle. If you're taking multiple medications, sit down with your pharmacist and review all of them, not just pain medications, but all your medications. Ask about our medication review program, where you bring all your medications into our pharmacists. We will look at all the medications, both prescriptions and over-the-counter, to check for duplications, expired medications, and possibly discontinued meds. There are no charges for this service. It's a free service, and you don't have to be our customers. Northlake Medical Pharmacies with 2 locations for you, at Hill Road next to Sutter Lakeside Hospital, and outside the Bruno Shop Smart in Lakeport.
It may not require a textbook, but it's filled with valuable lessons. It may not take place in a classroom, but it's an ideal environment for learning. It may not involve a diploma, but it can help prepare California's young people for life. It's high school sports. High school sports can play a critical role in a student's overall education. In fact, studies show that students that participate in high school sports are more likely to enjoy greater levels of achievement in their academic lives. If you think high school sports are only about competition, think again. Better yet, think about attending a high school sporting event in your community. You'll be amazed by what you see. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
Army Specialist Andrew Pike became paralyzed while serving in Iraq.
My injury was a gunshot wound to the left abdomen from a sniper. My first contact with paralyzed veterans was in Walter Reed.
Paralyzed Veterans National Service Officer Michael Killen.
We try to reassure them what benefits are out there, try to educate them and take some of that stress away from them.
Right now I'm going back to school to earn a degree, and I'm just spending time with my wife and child.
You can help our paralyzed veterans. Visit pva.org.
America had just gone to war when Felipe Adams volunteered.
I knew what I was signing up for. I knew the consequences. I took a bullet to the side and left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
Armando and Felipe were brought together by a unique organization that serves our paralyzed veterans.
If there was no PVA, it'd be a lot of confusion. Our training is to better the veteran. We help out with the auto grant, the special housing adaptation grant, education, prosthetics. Our main focus is spinal cord injury and disease, but we see anybody.
First thing he had asked me before he even asked my name was I being taken care of as a veteran, and I thought that was pretty good.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org.
And we're back.
We are back, and now we're talking about still prescription painkillers, on why that's so important, where you store them. And, you know, you just don't think about it, even if it's about packing it for a special reason. It can be just sitting around the house. And, it's, you know, a scenario that I think about is when my grandkids are coming, and sometimes I just throw it in a drawer, you know, so they're young and they're not old enough to get into that. But and then I forget I have them there, and that's exactly where people that are stealing from you, if your house is broken into, they look in your sock drawer, or they look in your shoes, or they look in things that you wouldn't think that, and the results are really concerning, because too many of those potentially deadly drugs wind up in the wrong hands. And pain relievers are by far the most commonly abused prescription drugs, with more than half the people who abuse them reporting that they got the drugs for free from family and friends. More than 47,000 Americans died of a drug overdose in 2014. You can imagine how much greater it was in 15. That was more than any other year on record. Number one culprit, the same painkillers that some people don't keep locked up. In fact, the CDC found that overdose deaths from prescription pain relievers, which have skyrocketed in the last decade, also reached record highs, up 9% in 2014 alone. So leaving narcotics unsecured is like, and I'm sorry about preaching, but this has become such a big issue.
Bill, we have a call.
Okay.
Get you all set up here, and let's see. Good morning. You're on Health Talk.
Yeah, this may sound stupid, but on a lot of pills, take a full glass of water with the pill. Drink a 8 ounce, 12 ounce, or what? And you're supposed to drink it straight down, or what?
Yeah, and the reason, at least an 8 ounce glass of water, and that's plenty, even 4 ounces would probably be adequate. But the reason you want to drink a full glass of water with it is you want to get it into your system and soluble so it dissolves into the bloodstream as quick as possible. So that's the purpose. And some people even drink warm water with it because the heat makes it break up even or dissolve even quicker. So yeah, an 8 ounce, even a 4 ounce, and it depends on how many pills you're taking. If you're taking 8 or 9 pills, you don't have to take 8 or 9 glasses of water. Take 3 or 4 at the same time.
Yeah.
If they're due at the same time. But that's the purpose, and it's a good purpose, and it's a good way to make sure that they get into your system quicker. We want the activity level of that drug to be as high as we can, as quick as we can.
Yeah, I figure it was sort of a stupid question, but
it's never stupid.
I see it all the time on the pills.
It's never stupid. I mean, when you are doing anything with medication and you can make it more efficient, you're not taught this when you go to school. We are taught this as pharmacists and physicians, and it's and sometimes we overlook something as simple as that.
Yeah.
So it's a good question, and I'm glad you called and asked it.
Thank you very much.
Thank you, sir. What seems simple to some of us isn't really simple when you're faced with this barrage of medications that many people take, and many people have to divide those into times of day because they're different acting medications and they do different things. Some of them, like some of the thyroid, needs to be taken the first thing in the morning to get into your system before it binds up with anything else. There are antibiotics like tetracycline-like drugs that can't be taken with milk because milk is a binding agent that binds up with the antibiotic and makes it so it's not soluble in your system. So back in the old days when all we had was antibiotics, tetracycline and sulfa, and penicillin, and lots of younger people took tetracycline for acne, and it was one of the main antibiotics for infections because we didn't have a lot of antibiotics in those days, and they would take it with milk. And especially if you were a teenager and one of the conditions that you took it for was acne, adolescent acne, the pimples, and the antibiotic worked well, but kids would take it with milk because they're milk drinkers anyway, and they wanted to get it into their system. And we found out that it wasn't nearly as effective and almost non-effective if you took it with milk. There are other antibiotics that we will tell you about, usually fluoxins, ciprofloxacin or floxacillins, that also are binding agents that bind up the drug. And some of them don't bind it up completely, but if they take any effectiveness away from it at all and you're really sick, it does make a difference. So there are some antibiotics that, like a Z-Pak, that will tell you to take 2 today and then 1 a day for the next 4 days. And you take those 2 with or without food, with a glass of water, at any time of the day to get into your system, and then there's only 4 more pills to take. So at approximately the same time, deciding on a time of day that you want to decide on, the next 4 days, take that medication with a full glass of water, the same time for the next 4 days. That's really important when you're taking one pill at a time, and or one pill a day for that medication, and you need to have it be the most effective. And you may not think anybody would get into your medication either if you leave them in the medicine cabinet, but teens or grandkids who know that grandma and grandpa take medication or mom and dad take medication, and it's quite well known if you're a chronic pain person that you're taking an opiate, you need to take 2 steps for safer, more responsible handling of those narcotics at home. Lock them up, secure prescription pain relievers and all other medications out of sight of visitors and children in a locked cabinet or container. Don't keep loose pills in your bags or containers in your purse. Easier said than done. When you're traveling, many times our luggage gets lost, and you never want to have your daily medications in your luggage that gets sent in the luggage compartment of the airplane or the train or another vehicle, because many times that won't get to the destination. So the second thing you do is discard of your unused pills properly, and I think we're all guilty, including myself. You take unwanted medication to drop-off spots at pharmacies. There are not nearly as many of those as there used to be because the federal government kept us from taking opiates, narcotics, the very thing that we're afraid of taking. So we do little of that anymore. If you do take them at the local level for a disposal, you have to have a law enforcement officer on site, which is prohibitively expensive for an independent business to do. Hospitals and clinics and long-term care centers many times have incinerators or something that you can use, or you can mail it to collection centers. If you want to find out where to drop off the pills or pick up a mailer, call the DEA registration area for a designated area. That number for the DEA to discard unused pills properly is 800-882-9539. Again, that's 800-882-9539. And that's the DEA's diversion center, and they will tell you where to drop off your medication, or they will send you a mailer to dispose of it. Or you can go on the DEA website and look for drug disposal. If there's no drop-off in your area and you don't want to use the mail-back option, you can always flush them down the toilet. Now, people will criticize me for saying that, because that's usually a bad idea because of the possibility of contaminating the water supply and possibly harming aquatic life. But the danger of someone accidentally getting his or her hands on opiates make flushing an acceptable option if you have no other choice, and it isn't illegal. And taking leftover pills from an old prescription can be dangerous because many of those drugs have expired, and many times when they expire, they turn into a product that could be harmful to you. Normally, when a antibiotic or pain medication expires, it just isn't effective. It becomes non-effective in the bloodstream. But some of them become toxic. So always find out before you leave it to laying outside someplace or putting it in the system if it's a toxic medication. Lots of people that break into homes don't even look at expiration dates. They just look at what the drug is there is new information about taking more antibiotics, as we talked about before, using antibiotics too readily. There is a change of a way people take antibiotics for urinary tract infections. We have gone up in complexity of the medications for UTIs and are now going back down. We're finding out that using fluoroquinolones like Cipro or fluoxetine Levaquin have been a problem because whenever you get a quinolone or a fluoroquinolone, we will tell you about the possibility of getting a ruptured tendon if you're on it for any length of time or you've been on it for a long period of time. And that was quite rare. It has become more significant now to not risk someone having an Achilles tendon or a ruptured tendon by taking a quinolone if there's other drugs that are just effective. The next drug we would try for a UTI would be a nitrofurantoin, would be Nitrobid, and it is a different kind of antibiotic that doesn't appear to be toxic at all if you're not allergic to furodantin, and just as effective to treat a urinary tract infection. And the last one that we would use, and is used quite frequently, another one of those that it's important that you take water with is Septra DS or Bactrim DS, which is a combination of sulfa and another antibiotic. And because sulfa isn't very soluble, it's one of those drugs that you want to take with a full glass of water. And not only stop with a full glass of water, but during the interim of taking this UTI antibiotic twice a day, 2 or 3 times in the middle of the day, take extra water. Now, again, the reason is sulfa isn't that soluble. It's going to work for your urinary tract infection if you only take the glass of water that you took it with in the morning and the glass of water you took it with in the evening. But if you drink even more water, it's going to be even more effective. So a lot of these things we need to talk to you about when you get the medication. And although some of the antibiotics are quite old, as far as being out in the market a long time, they are just as good as the fancier antibiotics and probably even better. And when you come to risk versus benefit, the risk is much smaller by taking this antibiotic. Now, you're going to accomplish a couple of things by this. By taking the nitrofurantoin, usually with food, 3 or 4 times a day, you're going to get a better rate of curing the infection. And you're going to cut down your risk of having some other problem with it. So those are important issues when it comes to you being compliant in taking your medication. In being in the pharmacy business, we have to be very compliant about buying our medications and utilize compliancy in generic dispensing, meaning the more generics we buy and the more generics we dispense, the more of a rebate we're going to get back because it's costing you less. The side effects of taking it are less, and there's more likely that the time span of taking that antibiotic will be met. You need to really be wise about how you're taking these medicines, and just because it costs you $1.26 or something for the antibiotic, and maybe the pharmacist wasn't the clearest about how you take this medication, you need to find out as much as you can about taking it and taking it properly and using it well. I was talking to my surgeon a little bit ago about taking medication for my knee, and he said, you have quite a bit of arthritis in that knee, and because you have that arthritis, he said, you'll probably need to take a non-steroidal anti-inflammatory pill like Celebrex or something like that as the knee heals, because the pain will be great and we don't want you taking opiates. But he said something else that was seldom that we talked to you about, and he said 6 months from now, because of the arthritis you have in there, it's going to be inflamed, and he said by then you may be able to take an injection of a steroid in that femur area and kneecap area, and will last you for some time and take care of that inflammation caused by the arthritis. The reason we don't want to give you that steroid at this point is your healing. And that antibiotic is going to interfere with the healing process and take it even longer. So that's why we wait in order to give you that steroid, even though you're in a lot of pain, and the pain's usually from arthritic things as well as the surgery. He said, let this go by and let the time element take its place and see what you can do, because and the last thing we're going to mention is, and we're going to mention it almost every day that we talk, is medical therapy management. And one of the meetings I was involved with last night from Chicago was about medical therapy management and what it's going to cost the individual pharmacy if they don't get involved in us actually getting involved in managing your therapy with the medications. And that we don't have you taking a medication that you don't need at the point. For example, if you still have an antibiotic on your file and it was for something you took a long time ago, a lot of dentists will still have people on antibiotics for if they have a prosthetic device. A lot of that's going by the wayside. The most of those things that we can take off that are red stars when your insurance company sees it, the less your copay is going to be and the more our reimbursement is going to be. So when it comes to us watching what you're taking and monitoring what you're taking and making sure, for example, that you're not in the age class that affects the Beers criteria, the 65 years and older group, we will be talking to you more than we ever had about maintaining compliance and maintaining therapy and the medications that you take. And as we go through our lives and end up going through the aging process and being a little more exposed to new medications, I just went through yesterday the 4 or 5 hepatitis C medications that you take either 6 weeks or 12 weeks or 18 weeks. The newest one out is for a 12-week period, $95,000 for one medication for 12 weeks. That didn't even shake up Paul. That's how I can tell if he's paying attention.
Sorry, I'm reading something online. What was he said? I'm reading an article.
We were talking, is it about medication therapy?
Well, it's about social disabilities of my son. But
well, you have a certain responsibility when you're listening to this program.
Okay, go ahead.
And this is about how involved pharmacists are going to be in handling medications, for example, that your son may or may not be on, or that you may or may not be on.
It's all going to go computerized,
and
isn't it?
Hepatitis C, the newest drug out right now for a 12-week therapy, is $95,000.
Oh, my goodness.
And then you have to, can you afford the copay? And if you can afford the copay, does the health practitioner
$95,000? Wow.
And you know what the reimbursement is for the pharmacy?
Zip.
$800.
What?
For $95,000.
Wow. Well, that's not even a percent.
And what they're going to do is they're going to eliminate small pharmacies from taking those kind of medications because they can't afford to wait 90 days for their $800, because the chances are they're going to have to go buy and buy that drug a couple of more times for that patient. before they ever get paid, and they will only get paid 0.9% of what it cost them. So, and that's when you get into mental health drugs, antipsychotics, it's the same kind of thing. So all of these new specialty drugs, I had a cousin of mine call the other day, and he has plaque psoriasis, where he forms these big plaques of skin.
That payback, which by the way is 0.008%. That's your payback right there.
Yeah, that's not good.
It's not even 0.1%. We're talking in the thousandths of percent.
Yeah, you know, and so what happens with those kind of things are the big manufacturers are paying the chain drug companies a higher reimbursement so they can afford to do it. But my cousin that just called about the psoriatic plaque, the new drug that came out for him was, I think, $73,000, and his copay was, I think, $573. It was huge. And they listed a whole bunch of drugs that are coming out in these categories that are called specialty meds that your local pharmacy isn't going to be able to afford to dispense because what they're getting reimbursed. And that's part of what I've been doing with this organization that I'm with independent pharmacies, in trying to get a better reimbursement cost either from the drug manufacturer or from the pharmacy benefit manager program. So as we go further into healthcare, we will see that our responsibility is, like I've told you this all the time this past year, is we're going to have to do a better job about what these things are costing us and get a better reimbursement. Or is our time up?
Our time is up.
I'd like to remind everybody that it's the end of the phone call. Our number is 263-5252 the next time you want to call in for this poor person. And we're located with two locations, one at 5136 Hill Road East across from Center Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there, Paul, at 263-1326. Is that right? 1328.
1328, okay. And
never let a bell ring.
And we'll see everybody back here again next Wednesday for Health Talk here on AM 1270 and FM 96.5 KXBX. And hey, by the way, I didn't mention this to you, Bill, but coming soon, we're going to be doing, the shows are going to be podcasting online.
Oh, really?
Yeah, so we'll talk more about that next time.
Wonderful. Thank you.